In this video, we will focus on the importance of sleep and introduce good sleep routine strategies. This video has been created by the MHST, the Mental Health Support Team. We are a team of professionals who deliver low-level mental health support within schools. We offer individual CBT-informed sessions, and we also offer groups and workshops. And we support schools with their whole school approach to mental health and well-being. First, let's think about why we need good sleep. There are a few reasons why we sleep: to grow, to process our memories, to clear the toxins that build up in the day, to heal our bodies, to replenish our energy, and to build muscle. We all go through sleep cycles, moving through light, deep, dream, waking, and going back to sleep. At stage 1, we feel drowsy, before moving into light sleep at stage 2. Then we move into moderate sleep, followed by deep sleep at stage 4, and finally the REM, rapid eye movement, or dream sleep stage. The cycle lasts for between an hour and a half to 2 hours, and we repeat this through the night. It is normal to wake briefly between cycles. This graph shows the stages of sleep that a person may experience in the night. How much sleep we need does depend upon our age. As you can see from this diagram created by the National Sleep Foundation, 8 to 13-year-olds are recommended to have between 9 and 11 hours per night, whilst 14 to 17-year-olds are recommended to aim for 8 to 10 hours. It is a good idea to stick to the recommended amount of sleep for your age. Sleep difficulties and mental health is a bit of a chicken and egg scenario. It's difficult to identify which comes first. On one hand, poor sleep can lead to mental health difficulties, increasing anxiety or feeling low. However, feeling low or experiencing increased anxiety can also lead to poor sleep. If you notice a change in your sleep patterns, it can be useful to try to think about what might be causing them. Is there an underlying worry? Are you finding it hard to maintain your normal activities due to feeling low? This slide shows what sleep difficulties may look like. You may find it hard to get to sleep or find it hard to stay asleep. You may find you are waking too early or feeling tired in the daytime. It may be hard to concentrate, or you may find movements difficult and have less energy for things. But remember, we are all individuals, so we may not experience all of these difficulties. Many of us will have difficulty sleeping at some point in our lives. It can be difficult to know what will have a negative impact on our sleep, but these are some things known to make sleep difficult. Using screens in bed or late evening, as this keeps us from beginning our sleep cycle. Drinking cola, fizzy drinks, caffeine or energy drinks too close to bedtime can have an impact. Eating chocolate can also affect sleep as it is a stimulant, so we should avoid these things in the afternoons. We can also be affected by eating a big meal just before bed or going to bed feeling hungry. Going to bed and waking up at different times each day can also have a negative impact on our sleep. Ideally, you should try to go to bed and get up at a similar time every day. Think about how hard it can be to come back to school after the holidays when your routine has altered. Getting back to good sleep can take time. Having naps may seem like a good idea, but it does not help you maintain regular, good quality sleep patterns, as it makes nighttime sleep worse. It is also important to not oversleep, as getting too much sleep can also make you feel more tired and reduce the quality of your sleep. If you're feeling low or overthinking things, this can also make it harder to have quality sleep. It should also be noted that some types of medication can affect sleep too. Ask your GP or pharmacist if you feel this is happening for you. Technology is a large part of our everyday lives, and it can be easy to forget how this affects us. Using a phone, tablet, or laptop in the hour before sleep can impact on our ability to get to sleep well. It's recommended to not use screens for an hour before you sleep. This can be a difficult change to make, so you may wish to gradually increase the time without screens. The reason for this is that the blue light from the screens sends the message to the brain that it's daytime and prevents the release of melatonin, which helps us sleep. This can then affect our body's ability to maintain a good sleep cycle. As previously said, maintaining a good routine of going to bed and getting up at a similar time each day promotes good sleep. This slide shows things that are known to help to improve sleep. Exercising each day. Try to do something you enjoy. Keeping a regular bed routine can help your body to prepare for sleep. Having a calm time before bed, for example reading or being in a space with low light. Reducing your screen time before bed as already explained in this video. And warmth, for it's important to feel comfortable and warm too. It can be hard to make changes, but can improve the quality of your sleep. Please note it may take about 2 weeks before you begin to notice a difference in your sleep. It can take time to make these changes, so be kind to yourself as you work to improve your sleep routines. This slide shows services who can support with a range of mental health needs.